Thank you so much for coming to this conversation about rising up. We are an IOP and also will be providing PHP services for patients that are struggling with grief and loss, perinatal mental health, trauma, and symptoms of depression and anxiety that accompany those things that happen to us on our life journey. So I have the staff with me today, and I'm very excited to introduce them to you. But first, what I would like to do is just ground us into the moment, just get present and leave all the things outside of this space so that we can really focus on learning about the program, meeting the staff, and if there are any questions that arise, feel free to ask them as we go forward. So, with that said, let's just take a moment to come into the room. Just take a breath in through the nose and just hold that breath at the belly button and exhale through the mouth. And as you breathe in again through the nose, just think about what it is that brought you here today into this session. To hear about the program. And breathe in again through the nose. And exhale through the mouth, thinking about your own grief and loss in life. And how coming to a space to be supported, seen, witnessed in those experiences, how that might help you as you hear about the program that we put together and the way that we're serving patients at this time. So thank you for coming. Excuse me, my name is Leigh-Ann Larson. I am the founder and CEO of Rising Up, and I am here today with quite a few of our staff members, which I'd like to introduce to you at this time. First and foremost, Colby Andrade, who is our clinical director. Colby, if you could just tell us a little bit about yourself and maybe some of the experiences that you've seen in these first, I don't know, has it been 40 days since we've started the program or on day 42 or 43, something like that? Maybe just a fun insight that you have that you've noticed.
Yeah. So I'm Colby, and I'm a licensed independent clinical social worker. Um, I like to believe that I lead from my heart center in most things that I do. And yeah, in these first, I'd say 6 weeks or so, 6 or 7 weeks, we've seen such beautiful group cohesion, and connection being made around, all types of life experiences. But more so those that have been very troubling for folks, and that's why they're with us, right? And so I think the most interesting thing I've seen is just the love and connection that is already fostered among group members. Um, and that is incredibly healing. Community and connection is such an important part of the work that we're doing. And seeing that right in our, first 6 weeks has been really, really awesome and very honorable. So.
Yeah. Thank you, Colby. I literally had goosebumps while you were saying that. I have to say that we are a holistic program. We're doing meditation, breath work, tapping. I'm personally providing EMDR for people that, want an EMDR session. And it's and the feedback, we'll go to Dawn next, who's our senior case manager. Maybe she can tell you a little bit about the feedback we've been receiving, but it's like this energetic connection that I think our facilitators are making with our patients are making it with each other. We're giving them opportunities to co-regulate and to really feel what it means to be operating on all, I have goosebumps again, all cylinders. Like I'm so excited about this program. Dawn, let's have you introduce yourself and maybe share some of the reflections that you've gotten so far.
Okay, sure. Thank you, Leanne. So my name's Dawn. I am the senior case manager here at Rising Up. And I do a check-in with folks initially, talk to them about their needs, and then create a goal plan based on their needs. So I also check in with folks from time to time, see how things are going, if their needs have changed, coordinate care with their providers, help them find providers if they need it. And in those sessions, I'm hearing folks say, I'm being heard, I'm being seen. They are helping me understand myself and what I am going through and giving me tools. And not only are they giving me tools, but I'm learning how to use those tools outside of group. And I think that's one of the biggest takeaways for me from these meetings with folks is that they are learning skills, they are learning tools that are tangible enough for them to use outside of their group therapy.
hmm I
It's just
think,
great.
yeah, this morning I think you were talking about two people who have had extensive experience in treatment programs. And they both have said, listen, this is different. This is different. This isn't, your run-of-the-mill program that I've been in. And, we've also been talking to other IOPs. We've been introducing ourselves to them. And Dawn and I have both been hearing this positive response to the reality that we are niching into trauma, that we are niching into perinatal mental health, that we are niching into grief and loss, because a lot of these programs are more of a broad sweep. And so you get all sorts of things happening in the room, and it really dilutes that connection. It dilutes that cohesion. It dilutes the healing nature of the groups that we're creating. So I think we're getting a lot of that feedback from other providers in this space that are like, keep going. This is a really important work that you're doing, the important space that you're filling. So I'm excited about that. Okay, Shannon. Shannon Goyette is one of our staff therapists. Shannon, introduce yourself and tell us a little reflection that you've been experiencing in this work.
Hello, I'm Shannon Goyette. So I'm one of the staff therapists. I also run a couple groups with the patients here. So I think, I mean, there are so many takeaways from doing this work, but I will say, and kind of to echo my colleagues, like one of the biggest things that I've noticed and that has been brought up to me from like members within the group is the sense of connection and the feeling of having that niche community and that support of like, other people are going through this, but because of the niche of the group, they feel so supported with that group. Whereas other IOPs, like you were saying, it's very broad spectrum. It's take what you need instead of having these smaller groups, these focus groups of, like we speak to every single one of the members and they have that connection with us, with each other. And yeah, so I think that's probably my biggest reflection.
Yeah, I love that. And we've talked about, how do we scale this so that we keep it intimate? We've talked about, we'll have multiple tracks. So we're new right now. We are licensed by the DPH. We just had our first conversation with the Joint Commission and expect to see them very shortly for our accreditation. And we are working with insurance plans now with single case agreements and out of network benefits. And also, we are priced very reasonably. Out of pocket is $300 for the entire day. And as many of you know, private practice practitioners will charge $250 for an hour. So we really are making this affordable for patients because we truly, truly are passionate about the work that we're doing. So as we grow, what we'll do is we'll actually niche specific. Perinatal will all be together. Grief related to maybe a violent death or an unexpected death will be grouped with, a separate group for maybe Alzheimer's, dementia, those types of passing. So we're really excited about keeping it intimate, keeping it focused, and really expanding our services, but in a way that doesn't make the groups feel bigger or overwhelming, but rather helps us just diversify what we're doing. Because we also know that providers in the field can burn out if they get overwhelmed with too much going on in the room. So we really want to make sure that we're not doing that. Okay, one more person I want to introduce you to is Kathleen Flannery, another staff therapist that has most recently joined us. And she is often leading the first group of the day. We've gotten brilliant feedback about her group work. And Kathleen, introduce yourself and tell us your takeaway.
Yeah, thank you for having me. I'm Kathleen Flannery. I'm one of the staff therapists at Rising Up. Like Leigh-Ann mentioned, I am running most of the morning groups most days. And some of the feedback that I've gotten, if I could just echo some of my coworkers, is just that there's a unique group of individuals. There's, a close-knit sort of sense of community amongst not only the patients or the members, but also the staff, and just a sense of like genuine empathy and togetherness. I think one of the things that we kind of try to do is look at grief and trauma as a universal experience. We may not have experienced the exact same type of grief, but all of us can relate to this sense of grieving, and so using that to create a sense of community with one another, as opposed to the what you usually hear, which is, take what you need and things like that. We do more of a we're all human, we're all in this together, we all can benefit from this work together, even if we haven't had the same exact experience type of thing. So it's been beautiful so far. So thank you so much for having me.
We're delighted. We're delighted. Such a great addition to the team. Kathleen's actually spent some time with me in a meditation program that I was doing, and we've just had a really wonderful time exploring spirituality, right? And ourselves as souls, right? Having a human experience. And I think we all bring that to the work. I really, truly do believe that for sure. Colby, help the listeners understand the difference between intensive outpatient program and someone who is doing traditional outpatient therapy, and then maybe contrast that to partial hospital programming, which we will also be able to provide if a patient needs it, because we're getting that dual licensure with the Joint Commission.
Yeah. So what separates an IOP from the traditional therapy is IOP, which stands for Intensive Outpatient Program, really is for folks who are experiencing more severe symptoms that are impacting their overall daily functioning. So people who, might be struggling with work, or maybe they're not working because symptoms are so severe, or attending school, right? And so IOP really provides a little extra care, as opposed to an individual biweekly or monthly outpatient session. Um, and so with IOP, group is a very important part of our IOP. So we have group several times a week, multiple groups a day. And combined with that, we also have case management to help bridge the gap with any other needs outside of the clinical realm. So, if people need resources or connections to local support, maybe that might look like someone really wants to get into yoga and they have nowhere to start or what to look for. Um,
Community
or
acupressure, community
yeah,
acupressure. good one.
Yeah, yeah,
Light therapy, right? Or those traditional. Yeah.
yeah, yeah. Or folks who, maybe want to find a Reiki provider and they don't know where to look. They don't know who to trust because, there's so much out there now. Um, and Then they have the individual therapy as well. And what we're really doing is looking to help folks stabilize. So that is done through skill acquisition, which mostly happens in groups, but then is also reiterated in our individual sessions as well. Um, for folks who are interested, that could also look like family therapy. Especially, if grief is involved, sometimes people might be looking for that. And so it's more care, multiple times throughout the week. And then partial hospitalization would be, I believe, less time. So that could be like 7 to 12 days. Um, and that may be for somebody who is really, really struggling. Maybe there's more suicidality there. Maybe not fully meeting hospitalization inpatient level of care, but they might need medication very quickly. And so partial hospitalization program can provide things of that nature, where right now we're working with people who are struggling, but they just don't meet that higher level of care. So that this is a higher level of care, but it is not the highest level of care, if that makes sense.
Right. I just want to
Um,
pause you there because I love this formula that we came up with. Partial hospital program is 5 days a week, 5 hours a day. IOP is 3 hours a day, 3 days a week. And we do have a prescriber on staff who can, and will meet with everybody. And if we find out that they need the 5 by 5, we can provide that. I think, Colby, what you were saying was PHP is shorter, not a shorter day or less days during the week, but only they might be at that intensity for 7 days and then drop down to IOP, where
yeah,
IOP can last for like up to 12 weeks.
exactly. Yes.
Yeah,
Thank you
yeah.
for that. Yeah.
No,
Yes.
no problem. No problem. But
Yep.
I
Yep.
love that math, like 5 by 5 PHP, 3 by 3 IOP. It just simplifies the whole thing. And of course, if you are using insurance, they're going to dictate how long you can be in the program. That's just the bottom line. Our job is to do a great job at assessing, make sure we can demonstrate medical necessity, help the patient understand that and where they're at, and set up treatment plans that are helpful and useful. Dawn, I would love to bring you in on this because we are utilizing your fabulous services very heavily on speaking with primary care physicians, therapists, prescribers, making sure they're receiving communication. So, can you talk a little bit about the intake process, what happens once they're here, how we're going to loop them in and be that bridge of communication?
Yeah, sure. So when we receive a referral, we would then verify benefits and do a pre-screen and admit them into the program where they would meet with a clinician to do the biopsychosocial. And at that point, we will establish their PCP or prescriber, outpatient therapist, and any other supports that they're receiving. Um, and at that, then I will reach out and have them sign a release, reach out to their providers, let them know that they're a part of the program, let them know that we're looking to bridge sort of the treatment so that we are not taking over their treatment, we are in collaboration with their treatment. And once they complete the program and discharge, we want to ensure that they will continue to get that care moving forward. So I will do outreach calls to providers, fax them treatment plans, release forms, get information back, get their medical records back from PCP offices, make sure that that's in the charts so that our psychiatrists will have that information as well. But it's been going great. We've had tremendous feedback from the therapists that I have been in touch with. A couple of PCP offices have sent us medical records already, so the communication is happening and it will continue to happen up until discharge and making sure that they are continuing that care.
That's wonderful. Yep, it's going very well. One thing I would add, and we might need to normalize this for some patients that come in, during the biopsychosocial, as we're doing that, the first thing we're doing is safety planning. And that might put off some patients because they may not have a history of any unsafe behaviors or unsafe thoughts. However, this level of care warrants that we make sure that everyone is safe. So the day they get their biopsychosocial, we're actually just taking 10 minutes first to just put a safety plan together for them. Just so that you know, who are your contacts if you are struggling? How are you going to know that you're struggling? What are your coping strategies that you're going to be able to access fairly easily? We just like to have that conversation so that everyone is safe. So if you do refer someone, just let them know, you will be doing a safety plan, not because they're judging you as unsafe, just because everybody gets a safety plan right at the beginning. Okay. I think that's really important to say so that it's not misunderstood about what that actually is. And of course, you can go to the website risingup-iop.com to fill out our contact form. There's also the main phone number on the website that you can call. Most likely, you'll get Dawn. You might get Colby. You might get our answering service, but they're wonderful humans. We get an email right away and we call back as soon as possible. We talked a little bit about what makes our program different or more unique than other IOPs. So I don't know if we need to dive in any deeper on that issue. Um, People that are on the call with us, do you have any questions about the intensive outpatient program? Maybe, or you know what? Let's talk about some of the groups actually. That would be good information to give. Colby, can you just talk about a couple of the groups that are on our schedule? I have to tell you, Colby has designed a large chunk of our curriculum. Shannon has also done a fabulous job with our curriculum. I had no idea that Colby was a graphic artist. It just kind of escaped me until I actually saw her curriculum and I was like, holy smokes, girl, so talented, so beautiful. Our prescriber, Dr. Valentine. Okay, and let me tell you what, Dr. Valentine, very heart-centered psychiatrist. I actually met him in Sedona at an EMDR conference. He's a trained shaman, and he is the most heart-centered, genuine person I've ever met. Not to say that everyone here isn't, but you know what I mean in terms of prescribers who are always lovely, but he's just a phenomenal. I would say he actually did a fire ceremony for us in what month was that? November, right? Was it November? Yeah, and it was just wonderful. So, anyways, I just went on a tangent about Dr. Valentine. What was I going to say about that? Oh, he saw the music therapy curriculum and said, I would like to attend that group. So really just a fabulous job, Colby. But can you tell us a little bit about some of the groups that maybe are a little different or unexpected that we are providing?
Yeah. So we definitely provide your traditional cognitive behavioral therapy, acceptance and commitment therapy, as well as we draw from polyvagal theory. So there is mind-body processing, stress reduction through movement. We do have our music group, which serves for creative expression. lots and lots of mindfulness based. And something really cool that we've done is we do a lot of intertwining. So there might be some mindfulness based stuff in a CBT group. Um, so even in health and safety, well, actually almost every group that we run has components of mindfulness, grounding activities, different resourcing, if you will, things that they can do to co-regulate when activated in a group. So healthy relationships, communication, shame and resilience, which can be a very powerful group, a very moving group for folks. DBT, which is very important in an IOP setting. Um, and yeah, so there's a lot of integrative work going on. Um, and so far it's working very well and people have been really receptive to it. And I think and as we go, we might implement new things,
Right.
or change things. Um, but yeah, things have been going great so far with the groups.
Right. Wonderful. And collectively, some of our certifications and trainings are in telehealth, which is really good because I think one of the things we maybe neglected to say was, by the way, it's online. We do have an office in Buzzards Bay, and I'm actually sitting in the group room right now. And the group room is set up like a computer lab, really. So people can come to the office if they would like to, but they still will be online. Dawn is here. I'm usually here in the mornings. And so there's other people in the building with them. But it is an online program. So there's certified telehealth work that we've done, backgrounds in EMDR, emotional freedom technique, brain spotting, certified mindfulness practitioners, hypnotherapy. Not that we do Reiki here, but we got a couple of Reiki master teachers in the house. I mean, this is genuinely, really, the body keeps the score sort of stuff that we're doing here in terms of making sure that we're helping people rewire and really leverage the unbelievable supernatural abilities that we have as humans to change the story, to change the chemistry, to get back to a place of wholeness and healing. I think on some levels that maybe people have never even experienced before, you know? Yeah, in a nutshell. Okay, do we have any questions? I see Kelly on here, Erin on here. Does anyone have any questions about what we're doing or wanting to refer someone or anything like that? Erin's got a no there. Kelly, you have anything for us?
No, but thank you guys so much. This was very informative. I had one question about if you served adolescents, but I found the answer on your website.
Okay, yeah. Unfortunately, it is
Yeah.
adult only, 18 plus, because there are many, many programs out there that are serving adolescents that we really respect, like McLean's, um,
Hmm.
Southeast, and then also Pembroke has IOP programming for adolescents. In Rhode Island, we have Butler. So I feel like, our goal was really to fill a niche that wasn't really being served at this time or wasn't being served as fully, But 18-year-olds are welcome to join us. 18, 19, any 18 plus is fine.
And then I don't know if you guys answered this, but I'm sorry if you did, but do you guys take insurance?
We do. We are working with signing off on a contract with Aetna. And Dawn might be better able to answer this question. I know Blue Cross Blue Shield PPO, also the point 32. Is it point 30?
32 health,
All the point
which is
30.
your Harvard Pilgrim Tufts.
Yeah. And we are going to be going the route with WellSense and all that. We just have to wait until we have our accreditation so that we can get in network. So I
Okay.
encourage everyone to reach out, whether they have the insurance that we take or not. Like I said, we are at an for IOPs an affordable price point. And even if they're not able to do a full 12-week program, but they can work something out where they can come for a couple of weeks, a few weeks, we will most certainly work with people to make that happen for them. 100%.
Awesome.
Yeah.
Thank you.
You're welcome. You're welcome. All right. Kathleen, do you have anything you would like to add, or are you good? I want to make sure everyone feels whole before we end this.
I think we covered everything. I think I'm good.
Okay, thank you. Colby, how about you?
Nope, I'm good.
You're good. Okay, and Shannon.
I think I'm good. I'm just so excited that we're out in the community and doing outreach and cultivating this culture and, able to serve a need that needs to be fulfilled.
Absolutely, absolutely. I will say this, and I'm sure Dawn won't mind because Dawn loves talking to people. If you have questions, if you need referrals someplace, Dawn is a rock star. She's been working in Southeastern Mass for like 20 years or something in this case management role and would be happy to help you. So even if it doesn't sound like we can serve that particular need, please reach out because I do believe in the behavioral health world. I believe in collaboration. I truly, truly do not believe in competition. That's just silliness. We are humans helping humans, period. And so Dawn would be more than happy to be supportive of you. Dawn, hopefully I just didn't tie you up 40 hours a week on the phone, but
Well, I was actually going to suggest to Kelly that she could try Reliance Behavioral Health because they also resilience. Sorry, it's called Resilience Behavioral Health and they work with adolescents.
Oh, good, 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 good. So there's another option for you. Our ideal client, of course, is an adult and they're struggling with their symptoms. So, whatever their symptoms are, whether it's depression, meaning I can't get out of bed in the morning, I struggle with work, I have no interest in doing my life. I am just lethargic. I don't even care if I'm here. That's your classic depression. Or anxiety. My head is racing. I'm obsessed with things. I'm stuck. I ruminate. It's so loud in my brain. I'm shaking like a chihuahua. I can't relax. Um, Intrusive thoughts, worrisome thoughts. Okay. People who are struggling with those kind of symptoms that are keep making it impossible to sleep, get to work and be productive, attend their classes in college, be a present parent or partner or worker, or just even driving down the street, right? Like I can't focus. The symptoms need to be somehow derailing you from getting through in a way that just feels good and normal and natural and okay. That's important. So the symptoms come from a grief, someone died, you lost your job, you have a health crisis, something radically has created loss in your life. You just had a baby. You're carrying a baby. You're having emotions related to this new role and the secondary losses that come from, oh, wow, now I'm not just me in the world. I have this other person or two to take care of going down the road. Um, or it's just a pervasive, anxiety or depression that came because you had childhood trauma. You grew up in a home that was neglectful. And I will tell you what, you don't need to have been beaten or abused physically to have childhood trauma. So they're actually finding that just kind of chronic neglect and neglect isn't always intentional, by the way, just from an absent parent or a crazy household with 20 kids in it or whatever can really change your brain chemistry. And we are helping people re-up that brain chemistry. So trauma like that or an acute trauma. You witnessed something major. First responders are a classic kind of ideal client, right? Patient, or um, just, being in the world right now. We're having a lot of people struggling with being in the world right now. Let me just timestamp this and say this is March of 2026. Okay. And people are struggling being in the world right now and experiencing it, depending on how exposed you are to things that are triggering to you, you're in trauma. And the symptoms are just really affecting you, right? If you're still functioning at work, you're doing okay, you're not getting in trouble, if you're thinking about taking PFMLA, you probably want to do an IOP. If you are thinking about dropping out of school for a semester, you should probably think about doing an IOP. If you're home with your newborn and you are feeling completely detached and that you're a terrible parent or there's something wrong with you, you probably need an IOP. There's nothing wrong with you. It's all chemistry. It's all chemistry, and you just need to be held energetically, psychologically, with some skills, with some support. You need to be witnessed. You need to be seen. You need to be um, valued for where you are right now and understand that you are okay, you are worthy, and you're going to get through it. And there are people that have dedicated their lives to help you do that. Yeah, that's my long answer. Okay, Colby, thank you so much for offering to close us today.
Yeah, absolutely. So I will lead us through a little guided meditation to close us out. So before we finish, let's just take a few minutes to settle together. And if it feels comfortable, you may soften your gaze or close your eyes if that feels good. And take a slow breath in and a gentle breath out. Again, breathing in and letting the breath out. Notice how your body naturally moves with your breath. Bring your attention to where your body is supported. Feel your feet on the floor, your legs, your back, your hands resting. The simple weight of your body being held. Allow your breath to find its own rhythm. Noticing the rise and fall of your chest, the expansion of your belly, and just bring your awareness to yourself in this moment. Recognize the effort it took to take this time for you today. And quietly, in your own mind, offer yourself a small acknowledgement. Thank yourself for showing up, for taking these moments, for giving yourself a little space to be present. You might notice a sense of calm settling in, or maybe just a steady, grounded presence. Whatever is here for you is welcome. Take another slow, full breath in and a long, complete breath out. Letting your body soften a little more with each exhale. If it feels right, gently wiggle your fingers or toes. Roll your shoulders. Stretch your arms. And when you're ready, lift your gaze, maybe placing a hand on your heart. Just giving yourself some gratitude for the time you made for yourself today. Thank you so much for being here.
Thank you so much. Thank you. Have a lovely, lovely rest of your week.